Thank you, President. My question is for the Health Minister. Over the past few months, we've seen
Order. Thank you. Are we done? Ms. Lovell on a point of order.
Point of order, President. Ms Pulford called the Minister, the Leader of the Opposition, a name that was most unparliamentary, and I think she should withdraw.
President, can I...
Thank you.
My question is for the Minister representing the Health Minister. Over the last few months, we've seen a severe and violent state response to pro-freedom demonstrations in Melbourne. Protest is currently illegal in Victoria by decree of the Minister and the Chief Health Officer. The stated purpose of the decree is to reduce the spread of COVID. The government argues that protests are a gathering and are therefore a transmission vector. Despite the risks of fines and police violence, thousands of Victorians have attended protests against this government and its draconian COVID regime. Although we know that outdoor spread of the virus is rare, the government has also criticised protesters for not wearing masks or social distancing properly. So given this supposed high-risk activity and that the government is contact tracing all the cases, there should be mountains of cases coming from protests. Minister, how many COVID cases have been linked to protests during this last lockdown?
Mr. Symes.
Thank you, President. I thank Mr Quilty's question at the outset. I condemn the protesting action that happened in recent times in this state. I condemn the behaviour that put at further risk the health and safety of Victorians, and I support any member of the government, indeed any member of Parliament, who has also condemned these actions. In relation to the specific data that you seek, Mr Quilty, I'm happy to seek information in relation to that. There is confirmation that there has been transmission at protesting activities. Whether it can be absolutely specific about when the cases are so high, exactly where all of the transmission sources are, and indeed you rely on the information provided by people who get COVID positive results through interview to reveal where they've been, who they've been in contact with. So in terms of the people that have been protesting and the reliability of the advice they may be providing could be questionable. So any data that we are able to provide you would probably come with some caveats, but I am certainly happy to ask the question for you.
Mr Quilty on a supplementary.
Thank you, Minister. There's no shortage of media outlets and politicians eager to demonise protesters, so if there were lots of cases coming from exposure at protests, we would expect to have heard about it. The only cases we've seen even remotely related to a protest or demonstration were people inside a building while a protest was happening outside. Even with such close exposure, there was little or no transmission at that demonstration. Worse still, police have turned up in droves in the city. Police are some of the few authorised workers that are exempt from vaccine requirements. These police show up in large crowds. They don't socially distance. In fact, they make an intentional effort to bunch people together. Police are as much a viral vector as protesters. COVID doesn't discriminate based on uniform. Under your logic, the police actions at protests must be contributing to the spread of the virus. We've heard of police stations being closed because of outbreaks. Minister, in the same time period, how many police have caught COVID, at protests or otherwise?
At least 2 in hospital.
Yeah, thank you, President. And whilst there was a lot of false assumption in Mr Quilty's question, there has been media reports, and indeed has been confirmed by the Police Minister, that there have been police admitted to hospital having contracted COVID. Again, I'm not sure that the Health Minister would have the level of detail about necessarily the occupations of every positive case that goes through the health records. In terms of employment records, Victoria Police would have probably information about who has contracted COVID within their ranks. So although I will seek the information from the Health Minister, I'm not convinced that that's the level of information that the Health Department would obtain and keep.